MBL and CHIP in the prior studies have looked at each one individually. We're the first study to look at both of them simultaneously. So we had a cohort of 10,000 individuals that we screened for both MBL and CHIP. And what we found is that the two precursor conditions are independent of each other. So there's no relationship between MBL and CHIP. Next, we went and looked at the association of each precursor with incident lymphoid malignancy. And we validated what prior studies have found, that having an MBL increases your risk of getting lymphoid malignancy about 4-fold. And then if you had CHIP, especially CHIP in one of the genes that are related to lymphoid malignancy, you also have a 4-fold increased risk of lymphoid malignancy. So these are findings that have been previously found, and our study is validating those findings. But what our study is unique is that we're able to look at both of them simultaneously. And so we looked at the interaction between MBL and CHIP for risk of lymphoid malignancy. And what we found is a synergistic interaction. What that means is that individuals with both MBL and CHIP have almost a 7.5-fold increased risk of lymphoid malignancy. This is compared to individuals with MBL only, so no CHIP. They have a 3.5-fold increased risk of lymphoid malignancy. And individuals with CHIP only, so no MBL, have just under 2-fold increased risk of lymphoid malignancy. So there's clearly a synergistic interaction between CHIP and MBL. When we looked for myeloid malignancy, we didn't see that interaction. And so regardless if you have MBL or not, individuals with CHIP have an increased risk of myeloid malignancy on the order of 6.5-fold.